I had a dog come through my clinic, a 7-year-old beagle named Olive. Her owner brought her in because Olive had been slower on walks. Nothing dramatic, just slower. The owner figured it was age catching up. When I put Olive on the table, I found 3 things in 3 minutes that her owner had never noticed. A lump the size of a grape, sitting just under her left rib cage. A rear molar cracked straight down the middle, infected, raw, almost certainly causing chronic pain with every bite she took. And her left ear canal was so packed with debris that she had probably been hearing the world through a wall for weeks. None of those things happened overnight. All of them were catchable. That is what keeps me up at night. Not the complex cases, the ones that required surgery, the ones where I needed every tool I had. Those cases come with their own difficulty. What keeps me up is Olive, and the dozens of dogs and cats just like her, who came in with something advanced that started small, something their owner would have noticed, if they had known what to look for. That is what I am going to give you today. I am going to teach you a complete physical assessment, the same one I walk through in a clinical exam, that you can do yourself at home once a month in about 20 minutes. By the end of this video, you will know exactly where to put your hands, what you are feeling for, and what crosses the line from normal into call your vet, starting this weekend. Stay with me because I need to explain something first, something that changes how you think about your pet's health entirely. Most pet owners operate on what I call the visible threshold. If the dog is eating, moving, and not crying, they assume things are fine. And I understand that completely. It is how we evaluate human health too. We feel okay, so we assume we are okay. The problem is that dogs and cats are biologically wired to hide discomfort. This is not a behavior quirk, it is evolutionary. In the wild, an animal that shows weakness gets targeted, so they compensate. They shift weight off a painful leg. They stop playing but still eat. They groom around a sore spot instead of letting you see it. By the time the discomfort becomes visible to you, becomes something you can see from across the room, it has usually been building for months. Think of your pet's body like a pressure cooker. The valve works perfectly for a long time. You cannot see the pressure building inside. And then one day, it releases. What looks sudden never was. That is the gap a monthly home check fills. Not because you are a veterinarian, you are not, and this does not replace professional care, but because you are the only person who sees your animal every single day. You know what their coat feels like on a Tuesday. You know how much they drink in the morning. You know how they smell. I do not know any of that. You do. And when something shifts, when the coat feels different, when the ear smells different, when the gait is just slightly off, you will catch it if you know what to look for. This is not about replacing your vet. It is about being the best possible partner to your vet. Because when you walk in with a specific observation, I felt a new lump here, it's been present for 3 weeks, it's roughly this size, it doesn't seem tender. That is infinitely more useful to me than I think something might be wrong. One of those gives me a head start. The other gives me nothing. I have spent 22 years doing this. I have been inside thousands of animals. I have held dogs through their last breaths on my table and looked at families over them and thought, if we had caught this 6 months ago, if someone had told them what to look for. I do not say that to frighten you. I say it because I have watched that gap between something small was there and now it is too late, close in real time, more times than I want to count. That is why I am sitting here talking to you instead of just seeing patients. Let me walk you through the assessment. It takes about 20 minutes. Do it once a month. Same weekend. Make it a habit. Put it in your calendar if that helps. You need a bathroom scale, a well-lit room, and your hands. Start with weight. This one surprises people. They assume they would notice if their pet gained or lost significant weight. They do not. A slow shift of 5 pounds on a 60-pound dog looks like nothing, but 5 pounds of fat or 5 pounds of muscle loss carries clinical meaning. Here is the bathroom scale trick. Weigh yourself first. Then pick up your dog and step back on. Subtract. That is your dog's weight. Log it in your phone. Just a note, date, and number. Over 6 months, you will have a trend line that tells me more than a single snapshot ever could. For cats, a kitchen food scale works beautifully for lighter animals. Now, set the number aside and use your hands. Body condition scoring is what vets use to assess healthy weight, and it is something you can learn to do in 60 seconds. Run your fingers along your dog's rib cage with moderate pressure, about the pressure you'd use to peel a sticker. You should feel individual ribs without pressing hard, but they should not be visually prominent. If you cannot feel them at all through significant fat, that is overweight. If they are jutting out with no cushioning, that is underweight. If it feels like pressing into the back of your hand, that is ideal. Middle of your palm is too thin. Completely padded over is too heavy. Practice it once and you will know the difference by feel. Have you ever tried this on your own dog? I would genuinely like to know in the comments what you find, and whether it matched what you expected. Here is where most monthly checks stop. Most online guides give you weight and coat and call it done. What I am going to share next is what I look for in a clinical exam, and where I find things owners missed for months. The mouth. This is the one. Dental disease affects over 70% of pets by age 3. 70%. And because of that threshold I mentioned, the one where they hide discomfort. Most pets with significant dental pain are still eating. They shift to the other side, they chew differently, but they eat. So owners assume the mouth is fine. Once a month, lift the lip on both sides. You are looking for 3 things. Gum color, it should be pink, the color of bubble gum. Pale white or gray is a circulation emergency. Bright red along the gum line is inflammation. Second, smell. A healthy mouth has very little odor. What most people call dog breath is not normal. It is the smell of bacterial infection. If you can smell it from arm's length, there is something happening in there. Third, tartar. The brown or yellow cement-like buildup that sits at the base of the teeth near the gum line. Some is common. Heavy buildup warrants a vet cleaning. The cracked tooth I found in Olive's mouth, that was a back molar. The owner had never looked that far back. Took me 4 seconds with a light. Some things only need 4 seconds. Now the ears. Healthy ears smell like nothing. If you lean in and smell something, yeasty, sweet, sour, skunky, that is an infection or an overgrowth of yeast. Healthy ear canals are clean and slightly pinkish. Brown or black debris, redness, or any discharge means something is going on. You are not going in there with a cotton swab. That packs debris deeper, and I have spent many clinic hours clearing the results of that. You are simply looking at the entrance of the canal with the ear flap lifted and your nose near it. That is the check. 30 seconds per ear. Anything that looks dark, smells off, or causes your dog to flinch when you lift the ear flap, call your vet. Let me tell you about a 10-year-old Cocker Spaniel named Biscuit. Cocker Spaniels are notorious for ear infections because of their floppy ear flaps, which trap moisture and limit airflow. Biscuit's owner started checking his ears monthly after a bad infection that cost several $100s to treat. For the next 3 years, they caught every early infection before it escalated. 2 of those early catches were treated with a single-week prescription. Without the monthly check, those would have been full courses of treatment, possibly with damage to the canal. Same dog, same breed. Completely different outcome because of 30 seconds a month. Skin and coat. Run your hands across your entire dog's body. Not a pat, a slow scan. Part the fur. You are feeling for lumps, bumps, thickened skin, or anything that was not there last month. You are looking for hair loss patches, redness, or flaking. You are smelling. A yeasty smell on the skin, particularly around the paws, belly, or ears, is a sign of a yeast overgrowth, which is common, treatable, and easy to miss under the fur. Lumps. This is the one that matters most. New lumps should always be checked. Most are nothing. Some are not. The rule I give every owner is this: if it is new and has been present for 2 weeks, have it looked at. Not because it is definitely concerning, Most are cysts, lipomas, skin tags, but because the ones that matter are also caught early, when treatment is most effective. I found a mass on a 9-year-old Labrador named Hector during a routine exam. His owner had assumed the small lump they had felt for about 6 weeks was a fatty cyst. Labradors commonly get them. It was not. Because we caught it at that size, the margin on the surgical removal was clean. Hector is 3 years out and doing exactly what Labradors do. The outcome would have been different at twice the size. Eyes. Look directly into them in decent light. Both eyes should be clear, bright, symmetrical. Cloudiness, a blue-gray haze over the lens, can indicate cataracts, which are manageable when caught. Redness in the whites of the eye, or a third eyelid that is visible in the inner corner, that pink or pale tissue, when it is raised more than usual, often signals inflammation or illness somewhere in the body. Discharge that is clear and occasional is usually fine. Discharge that is yellow, green, crusty every morning, or heavy, that warrants a look. Nails. Long enough that they click on hard floors is too long. You should barely hear them. Nails that curl or that the dog is walking around, those are uncomfortable and can alter gait over time, stressing joints. This one is purely mechanical. The check is simple. Flip a paw and look. It takes 10 seconds per foot. And finally, mobility. This is the most underused part of a home assessment and one of the most important. Watch your dog walk across the room. Watch them get up from lying down, not just whether they get up, but how. A dog with early joint pain takes a second longer to extend a leg on the way up. You will see it if you are watching for it. A stiff, slow rise from rest that loosens after a minute of movement is the pattern of early arthritis. That pattern, caught early, responds beautifully to joint support, weight management, and appropriate exercise modification. Caught late, after they are limping, after they stop trying to play, the options narrow. Do you watch how your pet gets up in the morning? That one small habit has more diagnostic value than most owners realize. Tell me in the comments. Does your dog take a second to warm up, or are they up and moving immediately? Here is what ties all of this together. Weight, body condition, mouth, ears, skin, eyes, nails, mobility. 8 checks. They sound like 8 separate things. They are not. Every single one of them measures the same thing. The gap between where your pet is and where the disease process has gotten to without you knowing. 8 different doors. They all lead to the same room, early detection, which translates into more options, less cost, and more time with the animal that has been with you through everything. That beagle, Olive, came back 3 months after I found those 3 things. The lump was benign, a sebaceous cyst that we removed cleanly in 15 minutes. The tooth was extracted, the infection cleared, and within 2 weeks, her owner told me she was eating with visible enthusiasm for the first time in months. She had not known Olive was in pain. How would she? Olive hit it perfectly. The ear was treated and resolved. At that follow-up, I showed her owner exactly how to do the monthly check I just walked you through. She looked at me for a moment and said, "Why didn't anyone tell me this sooner?" That question. I have heard it more times than I can count. In different voices, different clinics, different animals. It is part of why I make these videos. Because the answer to "why didn't anyone tell me" is that nobody had 20 minutes to sit down and explain it. Now, someone has. So here is what I want you to do. This weekend. Weight check. Bathroom scale. Do the math. Log it. Body condition. Run your hands along the ribs. Lift the lip. Smell the mouth. Look at the teeth. Flip both ear flaps and smell. Run your hands through the coat. Part the fur. Feel everything. Look into the eyes. Flip each paw and look at the nails. And tomorrow morning, watch how your dog gets up. 20 minutes. Once a month. That is the whole thing. If this feels like a lot, choose one. Just one. Maybe it is the mouth, because dental disease is the most common thing I see going unmanaged. Maybe it is the body condition check, because weight trend is the easiest data point to track over time. Start with the one that feels easiest to build into your weekend. Then add one more next month. Your dog has been with you through everything: the moves, the hard years, the nights when you needed something warm to lean against. They never asked for anything except your presence. They deserve 20 minutes once a month. That is all this is. If you know someone whose dog could benefit from this, a neighbor, a family member, a friend who just got a new puppy, send them this video. That is the only thing I ask. That is how this reaches the animals that need it. Everything I have shared today is general information based on current veterinary research and my clinical experience. It is not a replacement for your individual pet's veterinary care. Before making changes to your pet's diet, supplements, or health routine, talk to your vet, especially if your pet has existing health conditions. Your vet is your partner in this, and so am I.